Good morning. My name is Ruben Gonzalez, and today we're gonna do a practice medication administration to Millie Larsen, which is our female patient that has no allergies. Her date of birth is 1/1/1936. The patient doesn't have no allergies, as I say, and her medical record is 1, 2, 3, 4, 5, 6. I'm gonna perform some hygiene, and in the meantime, I'm gonna gather all my equipment, which I have over here, and also I'm gonna make sure that I'm providing the right medication, the right reason of the dose, the right route, and the right preparation. Okay, now I'm gonna go and check and look at my oral medication here, which I have Docuzet 100 milligrams orally. The time is gonna be now, and this is gonna help her out for soften her stool. So I'm gonna take here Docuzet. It says 100 milligrams Docuzet, Prati Docuzet, and 100 milligrams Prati Docuzet is gonna be now indication for soft stool. I'm gonna put it right here. I'm gonna put Docuzet, and it's gonna be 100 milligrams orally, one dose. Okay, so we got our first medication. The second one is gonna be our Prati insulin Lispro 10 units subcutaneously with Brayfax. The time is gonna be now. This is to control her blood sugar. We already checked her sugar and it was 260. And for this, we're gonna use the Prati insulin Lispro, which is 100 units per 1 ml. Basically, our order is 10 units, so we have to provide 0.1 ml. But we have our syringe, which is 29 gauge, and this one is measured by units, so we can use, the 10 units that they're asking. So we're gonna remove the cap, and then we're gonna clean the site, and I'm gonna clean the site. Let it dry. In the meantime, we're gonna prepare our syringe. Okay. So now what we're gonna do is that we're gonna try to remove some air from the syringe. So we're gonna go, like less than 1 ml, and we're gonna aspirate. And now, since that's dry, we're gonna take it out. We're gonna go in, and we're gonna try to take out 10 units. We're taking 10 units. Try to remove the bubbles. Okay, 10 units. We're gonna try to recap, and we got it right here. Now we're gonna mark. We're gonna put insulin. It's gonna be 10 units with Brayfax 0.1 ml. So that's our second medication. Now our 10th medication is gonna be haloperidol 2 milligrams intramuscular. The time is gonna be now. Is gonna be to control her agitation, and we're gonna provide 0.4 ml because we got in the vials 5 milligrams per 1 ml, and we had to provide 2 milligrams. So I'm gonna take it out. We're gonna pretend this is clean, and I'm gonna use an alcohol swab because I didn't get so many of them. I'm gonna clean it up again. Wait until it gets dry. So I'm gonna use my appropriate syringe. I'm gonna use a 22 gauge, and I will explain you later why. And this is gonna be intramuscular. I'm gonna make sure it's tied up, trying to maintain an aseptic technique. Again, we're gonna try, because it's gonna be less than 1 ml, so it's gonna be, we're gonna try to do like a half ml. Okay, so now we got our medication. Okay, so now okay, we're gonna take out 0.4 mLs. Okay, 0.4 mLs of haloperidol. Okay, so now I'm gonna put haloperidol 0.4 mLs, 2 milligrams. Okay, so now we got our medications. Again, I'm just gonna make sure I got practice DocuSet, and we're gonna see the expiration date, and it's gonna be August 2025. Okay, great. 100 milligrams orally. Great. Now we got insulin, 10 units, 0.1 ml. It's gonna be now to control the sugar, and we got it right here. And then we got haloperidol, 2 milligrams intramuscular, 0.4 ml. The time is now for agitation, and we got it ready. Okay, so now that we have all our medications ready, we're gonna go ahead, and I'm gonna go, hello Millie, my name is Ruben Gonzalez, and I'm gonna perform some hygiene, and I'm gonna go and verify. This is Millie Larson. Her date of birth is 01/01/1936. Do you have any allergies? She doesn't have no known allergies. So we verified that our patient is here. Okay, so now I'm gonna perform some hygiene again, and we already provide some privacy. I close the curtain again, some hygiene. And now I'm gonna proceed to give her the first medication, and always gonna make sure that I know this is the right patient, the right time, the right route, the right assessment, right education, and the right time if she wants to refuse. Okay, so I'm gonna tell her, okay, Millie, we're gonna give you the first medication, which is DocuSet, 100 milligrams orally. The time is now. This is gonna help you out to soften your stool. It's gonna be 1 pill. We're checking the expiration day, which is August 2025. We're gonna give you some water, and here we go. We're gonna reassess and see how she's feeling. Everything is good. So now we already know that this is Millie. Okay, so we're gonna proceed to give the second medication. I'm gonna do some hygiene, and also again, we're gonna put our gloves because we're gonna give some IV intramuscular and subcutaneous medications. So we're gonna go ahead and proceed with the second one. I'm gonna tell my patient that I'm gonna give her insulin. Is gonna be 10 units subcutaneously, 0.1 ml to control her sugar. We already know that her sugar level was 260. So we're gonna take insulin again, 10 units, 0.1 ml. We have it right here. We're gonna take our patient. What we're gonna do now is that I'm gonna clean up. We already know the location. We're gonna clean up first. While cleaning up, we leave here the landmark. Okay, so basically we had a couple of landmarks. We got the upper arm, we got the abdomen, we got the anterior thigh, the upper back, we got the upper ventral or dorsogluteal area. The area that we choose is the abdomen because it's a fastest route, and and we're gonna use a 29 gauge, and we're gonna try to pinch the skin. Okay, we're pinching the skin, and basically what we're gonna do is that we're gonna go below the costal margin to the iliac crest. Okay, we're gonna go to a 40 to a 90 degree angle, but we're gonna go to a 90 degree angle because Lily is not that skinny. Okay, so again, I have my medication. I'm gonna make sure there is no bubbles. I'm gonna take out the safety. I'm gonna pinch, and I'm gonna go ahead 90 degree angle, give the medication to Lily, try to take it out slowly, leave it up, recap. Oh, sorry. Just put the safety and then throw out the medication. Okay, so we throw out the medication. This says that we're supposed to put like apply some gentle pressure, but if needed. But for subcutaneous, we don't need it at the moment. Okay. Now we're gonna proceed with the other medication, and it's gonna be haloperidol 2 milligrams intramuscular. It's gonna be 0.4 mLs. Intramuscular is to control her agitation. Okay, so basically this is gonna be intramuscular, and we got different sites. As I told the patient, this is gonna be to control her agitation, and the three sites are gonna be the vastus lateralis, the deltoid, and ventrogluteal. Right now we're gonna use the ventrogluteal, so that's why I'm using a 22 gauge. And so I'm gonna prepare the site again, and preparing the site. Let's pretend this is a new alcohol one because I don't have more, unfortunately. So I'm gonna clean up the site and wait until it gets dry, and I'm doing a landmark. So as I say, I'm gonna go 90 degree angle because it's gonna be intramuscular, and I'm gonna go to the ventrogluteal area. So again, I have haloperidol 2 milligrams intramuscular 0.4 mLs. The time is gonna be now. It's gonna be for agitation. We're gonna take out this safety one. We're gonna spray out the skin, stabilize, and we're gonna go on 90 degree angle. And then we're gonna give the medication, and we're gonna come out slowly. Okay, once we come out slowly, what we're gonna do is that we're gonna put the safety, and then we're gonna throw out to sharpest container, and then we're gonna apply some gentle pressure, okay, and then we're gonna see if there is no any allergy reaction and reassess the patient. And then after being done, we're gonna remove our gloves. We're gonna do some hygiene. We're gonna document everything. We're gonna make sure this is the the right documentation and right response. I'm gonna sign, and then my initials, and I'm done.